So here's a consultation, new patient who came from Georgia all the way to Newport Beach, California. He had this bridge recently done here, and you can see it was up in this area of his mouth, which, you know, this is a pretty classic example of a case, because if you don't think about putting the teeth in the back of the jaw and the biomechanics and how the case functions, this is what happens. And so we have to consider the whole mouth. We have to consider, you know, the forces, the bite forces, and the mechanical issues of our mouths, and not just think about the aesthetics. I mean, it's a beautiful bridge, it looks great, but not replacing the molars creates a situation where it's guaranteed to fail. It will not work. The teeth cannot handle that much load, especially when you have this long of a span of bridge. It's just a matter of time before the case fails. So here at Trust Implants, you know, we will plan this case out so that we have implants to replace the teeth that are missing, so that when he chews in the back of the jaw, there's plenty of support back there, and the bridge we create in the front of the jaw will be protected by the support of the back of the jaw. So it's a nice case, because we will be able to help this patient a lot by giving him a mouth that's balanced, beautifully aesthetic, of course, but more importantly, the biomechanics of it will work ideal. And so, you know, by planning this out correctly and taking all the necessary steps, having all the instrumentation, the imaging, and the tooling, the implants, diagnostics, everything from the planning of the case to the placement of the implants to the delivery of the final prosthesis, it's all tied together. So it has to be done perfectly in order to have success. You know, these cases can be an investment. It's something that you have to, but it's a lifelong investment. It's something that will last the rest of their life if properly planned. Now, let's say he ended up and they did just an all-on-4 on him. In time, that would fail as well, because the biomechanics are off. They're just not thinking about biomechanics. They're thinking about giving teeth same day, or teeth, you know, minimizing the number of implants, and they're trying to dumb down a procedure that is so highly demanding, technically, surgically, prosthetically. It's very demanding, and you cannot dumb down or slow down the process or speed up the process. And so the idea of just pulling these teeth out, putting in 4 implants on the top, 4 on the bottom, is, you know, it's just one step, one more thing the patient will have to pay for that ultimately will not work. So proper planning, proper implant placement, proper materials will allow success in this case. Knowing where the sinuses are, knowing lengths, diameter of implants, it's all plays into it. And so it's important that everything is done properly and correctly. And each case is different. Every patient is different, and every scenario is different. And so you have to treat it individually. Everything from the bone diameters to lengths to available bone. And so all of that plays into the decision making as we're preparing and planning for these cases. Okay, so here's the kind of the overall view of your x-ray. I'm just kind of doing some planning here. So most likely we would probably take out all of the teeth, the remaining teeth.
Okay.
And then just put in all implants. And so the bone looks good. We've got good bone to work with, so that's obviously that's critically important, you know.
Yes.
The key will be just maintaining it at home, brushing, flossing, irrigating, using water pick, the whole works. Yep, you've kind of probably already been down that path. So yeah, so
I have a water pick, the brush that vibrates.
I mean, we may keep some of the teeth, which is a good thing, because teeth have what's called proprioception. You know, if you're eating popcorn or something, you get a little piece of popcorn kernel stuck in between your teeth. It'll kind of drive you nuts till you get it out of there.
That's right, yeah.
And so with implants, we lose some of that proprioception. So
Okay.
proprioception is important because if you were to bite down on something hard, it'll hurt. So you pull back and
That's
you don't break a tooth.
Okay.
So there's a lot of things that we consider when doing cases like this. And I need to look at the x-rays they took to see. Now, if the tooth is not viable and is not gonna last the rest of your life, then it's coming out, you know what I mean? So,
I got you.
so this is kind of a tentative plan of what it would be like. So now cases like this can be expensive, as you can imagine, you know. Get this done in about 4 trips out.
Okay.
So you'd have to come out 4 times.
4 times to get this work here done.
Yeah,
Okay.
yeah. So worth every penny. If I could put it in your mouth for a day and say, go eat a steak, you'd come running back going, all right, let's do it.
Man,
So,
yeah. And with, I see how it's kind of set back. Is that going towards the back
yeah,
area?
this is the back. Yeah. What I'm doing here is just looking at where the implants are in relationship to the nerve.
Okay.
Yeah. Yeah, so that's it right there. So, so let's, if you want, you can use your phone, take a picture of this.
Okay.
That way you kind of
Sure.
have an idea. And then, you know, being that you've come this far, and if you decide you do want to do
Slash on there.
something, we'll take advantage of while we have you here and get as much done as we can.
Yeah.